So we're on our second part of our series video lectures. In the previous video, we have discussed about the different approaches to community development, and we are going to start with the next one, which is the HRDP COPAR, or first the HRDP part, or the Health Resource Development Program. So from the word health resource, okay, uh, these are resources uh, dealing with the health of a community who is under development. Okay, and sometimes references would use this as uh, human health resources development program. Okay, so this is initiated by the Population Center Foundation as its contribution to the development of alternative healthcare system in the Philippines. It is based on a belief that potential health manpower, okay, so that is the resources, health resources, manpower is one of the health resources, exists in the form of students, then faculty and hospital or clinic staff who can be mobilized to work with people and to act on their own health problem later on as the community undergoes development. Okay, so further, this HRDP is a model for establishing and implementing effective, sustainable, and participatory primary healthcare programs in your depressed, deprived, underserved communities, or the DDU communities. Okay, so again, this is a model for establishing and implementing effective, sustainable, and participatory PHC programs in DDU communities. Further, it also entails development and mobilization of students and faculty of paramedical institutions or medical institutions, um, just like our school, okay, and the nursing schools in the Philippines. So, and it enriches health-oriented curriculum, and they reorient, no, the health education of future health workers to be more responsive and relevant to the current community health needs. So this is always based, no, on the status of the community, based on the needs, based on the problems of the community. Okay? Ayan po. Then next, so what are goals and objectives of HRDP? So it seeks to develop health personnel at two levels. One is from the NGO or the institutional level, so development of health personnel as the staff of a facility, the faculty and students of a school. Right? So then letter B, it seeks to develop health personnel in the community level, the community leaders and residents, volunteers, and um, committee leaders nila, potential leaders nila, core group members nila. Okay? Um, these are developed, no? And as a result, we want a more responsive healthcare system in the community. Okay? And later on, if ever all communities in the Philippines have undergone this HRDP COPAR program, the whole of the Philippines will have a responsive healthcare system. Yeah. So again, the goals of and objectives is to have a more responsive healthcare system in the Philippines or in the community by developing NGO or institutional level staff, faculty, students, and community level leaders and residents. And so, as said earlier, we need to require them, maybe ask their participation yung community. Hindi po pwedeng organizers lang, itong staff, faculty, students lang ang magtatrabaho dito in the development of a community. So, dapat lahat, lalong-lalo na yung community. Then objectives, expansion of health services delivered by private institutions. When you say expansion is it will reach the community, lalo na sa atin sa schools, because the translation of what we have learned, what we have gained as knowledge, skills, and even attitude as students and faculty, we need to apply it in the community. That's one way of contributing, but that's one way of giving back uh, to the development of our communities. And second, capability building of institutions to increase the involvement of partner communities. So capacitate the institutions on how to or train them on how to build the capacity, the capability of your partner communities. Okay? So, usually naman dyan, with this HRDP COPAR program, nagkakaroon muna ng training ang mga yan. Qualified to make staff, to make students, to make faculty, um, qualified community organizers. Meron yung training. So that is capability building. Then later on, you will pass this down to the community level. And then third, to develop schemes for innovative services and make it part of the curriculum. Okay, so to create, to develop some strategies, approaches, uh, to make your services, sabi nga dito, is innovative, something new, something that is really effective, efficient, and for the good of the community. Uh, and it will be part of the curriculum, sabi dyan. So, that's why now you would understand na bakit may ganitong programa, especially sa ating sa school, ang curriculum, because it's really um, this is required, no? And not really, I mean, aside from it is required, sabi ko kanina, it's the translation, it's one way of giving back, okay, to the community. It's the application of what you have thought or learned, no? uh, in your 4 years stay or 2 years stay in the institution. And then fourth, to support initial community efforts in seeking ways to sustain health service delivery. Fifth, to review and evaluate the efforts and institutionalize those that work. And six, to develop the capability of partner communities towards self-reliance in health. Okay, so yan yung one of the main goals. Okay, why we are doing this HRDP, COPAR, paid C programs in the communities. We want them to be a self-reliant community, to be an independent community, starting from knowing their problems to solving their own problems, to be recognized in the larger society that this community has contribution, that this community has dignity as a community. So those are the objectives of HRDP. Then next we have community organizing. Yan. So community organizing is a promising tool for achieving the primary healthcare goals of self-reliance and self-determination. Okay. This is a continuous and sustained process of educating the people to understand and develop their critical awareness of their existing conditions, working with people collectively and efficiently on their imme- immediate and long-term problems, mobilizing the people to develop the capability and readiness to respond and take action on their immediate needs towards solving their long-term problems. So it's quite lengthy definition, but this definition really summarizes, no, the whole topic that we are discussing and about to discuss later on. So just to dissect natin yung definition stated. This is a continuous and sustained. Okay? So, ibig sabihin nito, tatagalogin natin is tuloy-tuloy ito. It's continuous and Yeah, sabi ko, aside from it sustains, ibig sabihin hindi siya magka-falter, hindi siya mag-end dapat. Hindi dapat siya mahihinto. Yun dapat yung prinsipyo ng community organizing, continuous sustained development. Okay? Reaching different levels of a community development. And this is continuous, sabi ko dito, continuous education of people. Okay? So, um, it doesn't stop in a certain level. Okay? It doesn't stop when you reach the topmost possible community development status. Continuous pa rin yan. And sabi dito, no, you educate people to understand and develop their critical awareness. So pag sinabing develop their critical awareness is you let them be aware of their existing condition, of their existing needs, problems, status. So you do not dictate na kung ano yung napapansin mong problema sa kanila or sa community nila. Okay, those problems, those needs, their status should come from themselves. Yan po. And what else? Um, Working with people collectively and efficiently on their immediate and long-term problems. Okay, working with them means you do not work for them. The word there is with. Okay, you work with the people. They are your partners. Okay, they should not be dependent on you. Okay, you should both the institution and the community should work together on a common goal, on the purpose of becoming self-reliant community. Okay? And po. Then mobilizing the people to develop their capability and readiness to respond and take action. So when you say mobilize them, you make them empowered. You put you let them do the task, the action, uh, of solving their problems. You are there as a guide at first to facilitate it, but later on, okay, with this principle of community organizing, you are going to leave the community. So dapat bago mo sila iwan as community organizers, you must ensure that they can later on solve their own problems. Uh, and po. And what else? Readiness to respond and take action on their immediate needs toward and solving their long-term, short-term, middle-term problems. And so, yung hindi sila aasa sa iba. They would be, sabi nga, self-reliant or they would be independent. They have the capacity to recognize their problem, plan for their problem, set interventions, and solve their own problems. And applying nursing care processes, evaluate their own problems also. Yan po ang community organizing. So what are the objectives here? Sabi po dito is to make people aware of the social realities. Yan, toward the development of local initiative and strengthening people's capabilities. Okay? This was explained earlier to form structures that uphold the people's basic interests. So when you say structures, this can be physical structure, establishment, but this is more of institution, more of people groups, more of committees, and more of institutions that can really sabi dito, uphold, no, the interests, the needs, the concerns of the people, the issues of the people. When you say uphold, it's either um, uh, how are you going to act upon it, whether you will do it independently or with partners or with sponsors or with the local government where your community belong or belongs. And third, initiate responsible actions to address community health and social problems. The word there is initiate. Have the initiative. The community people should start uh, recognizing, solving their problems, right? Even just setting some sets of interventions, and if they need help from others, they can do. No? Basta yung initiative dapat manggaling po sa community. And yung objectives natin. Then what are the emphasis of community organizing in relation to primary health care? Okay, community working to solve its own problems. Okay, I've mentioned several times already. They should be working on their own problems. Direction is established internally rather than externally. Sabi ko nga, just like in the previous slide, the um, initiative should start from them. Okay, and they should set the direction, the goal where they are heading. Okay, they should know where this community is heading. They should know where this problem solution is heading. Process of capability building is more important than the output. Okay, so the process of capability building, sabi dyan, is more important than the output. It's how the community is going through the development process. It's not the end goal, lalo na madalian, hindi po. No? It's how they will learn to develop their own community. Then consciousness raising is facilitated. Okay? I have explained this one earlier. When you say consciousness raising, you um, you let them be aware, consciousness awareness. You let them be aware of their current problems, current situation, but okay, that awareness that we have a problem, that awareness that we have a concern, we have this issue to solve, should come from the community people. Okay, sabi lang dito is facilitated. You assist them in raising the awareness. You are not going to dictate this is your problem. The community needs this. Okay? So, hindi po ganun. So, again, community working to solve its own problems. Direction is established internally rather than externally. Process of capability building is more important than the output. And consciousness raising is facilitated. Yan po. Next, principles. Okay, this is easy to understand. The principles of community organizing is one, people, especially the most oppressed, the most exploited, and deprived sectors are open to change because this community organizing are for these types of communities. Sabi nga na earlier, diba, DDU communities, depressed, deprived, underserved communities. And this translation is the most oppressed, most exploited, deprived sectors. But aside from that, this is very important, they should be open to change because they would not attain development if they are not open to changes. And second, based on the interests of the poorest sectors of the society. Again, as I mentioned several times already, the interests, the needs, the problems, issues, concerns of the community should come from the community people, not from the organizers, not from the staff, not from the students. Maybe the least as you can observe and say something, but at the end, it's for the community, it's by the community, it's for the community. And third principle, it should lead to a self-reliant community and society. Yeah. So those are the principles: open to change, then from the interest of the people, and leads to self-reliant community. Alright, so let's discuss participatory action research. It's an action research. I guess you're third year, right? You're doing your researches now, and one of the researches are action research. Okay? And I'll leave the explanation of that to your instructor. And so, what is PAR or what is PAR? Okay, what's participatory action research? It's an investigative investigation of the problems and issues concerning the life and environment of the underprivileged in society by way of a research. And so, collaboration with the underprivileged. So, kating ko dun, no? Again, this is a study. It's finding out what is the problem, the issues of the community through research process. Okay? May prosesong susundin or as simple as steps, phases, process. Hindi yan basta nagtatanong ka na lang, then ito na. Okay? Di may listahan na ito yung problema. No. Sabi dito, investigation is done. Okay? And sabi dyan, the words are action, research. And whose representatives participate in the actual research process as equal partners in studying their own problem. Okay? So sabi dyan is participate in the actual research process. Kaya po tinawag na participatory. It's not only the school, it's not only the hospital that will do the what's this? The study, the investigation, but also the community. Okay? So, tuturuan mo din sila sa proseso ng research. Paano ba ginagawa ito? Okay? You're not naman going to give everything to the community. Siyempre, they would undergo studies pa, trainings on how to do this action research. Yan. Maybe you can give them depende depende sa sitwasyon, depende sa training, sa educational status ng, ng kung sinong representative nila. Okay? So, there are some phases, there are some tasks of the research that you can ask them to do as ikaw naman sa iba. Basta it should be participated by both parties. And sabi nga dito, they should be treated as equal partners in studying their own problems. Kasi sarili problema nila yan. Okay? Dapat pag-aralan nila, dapat solusyonan nila. The central element of this participatory action research is the word participation. Okay, the community people should participate as well as the institution. Okay, participation is an active process whereby the expected beneficiaries of the research are the main actors in the research process. Okay, it's even though I'm mentioning about the institution, it is highlighted here, it is emphasized here that the beneficiaries, meaning the community people, are the ones who are considered main actors. Okay? Yan po. Para sa kanila talaga yun eh. Yung word na participation. Kaya po sabi sa previous slide, they should be open to changes. They should be open to development. They should participate. Okay? They should be empowered. Yan po ang ating central element. That is our participatory action research. Objectives of PAR, if I may use that term, encourages consciousness of their suffering and develop competence in changing their situation. Okay, so this also explained earlier. Help in organization building by harnessing both human and material resources in responding to the community needs. Okay, when you in participatory action research is you are going to make use of the resources that is present in the community as much as possible. And so when you see resources, both material, establishment, equipment, supply, lalong-lalo na yung community people as the human resource. Okay? Third, enhances the knowledge of the researchers and the community on the social reality before them. Okay? So it's not only na aside from sabi dito, enhances the knowledge. They should know that the reality is this. Yan ang ibig sabihin ng number 3. That this is the situation. Okay? We need to do something. We need to act. Okay? Yan yung number 3. Okay, what is the process? What are the different phases? We have your PAR process or PAR process. First is preparatory phase, under which is or are immersion with the community and the different stages pa. Okay, of immersion, preliminary observation of studies, selection of the research team or group, choice and definition of the theme, training of the local researchers, and Second is operational phase, collective data synthesis, analysis, dissemination, and research utilization. Let me see. Okay, so here, first is sabi dito sa preparatory phase is we need to immerse. Okay? When you say immerse, you are going to put yourself in the community. You are going to live like a local, sabi nga. You get to know the community people, the leaders there, get a feel of the community. Know their culture, know their history, know the situation, and so be one with the community. That's immersion. It's like integration. Be one with them. I remember during our time, we even sleep in the community for several days as part of our immersion. Yan, nakakamiss mag-community din. Ah, lalo na community immersion. Yan. So, sabi dito, you are going to observe. You are going to assess. You are going to observe the study areas of the community. Then later, when you have established your rapport in the community, it's also one way of building rapport, which is ang important sa building rapport with the community is you have to gain their trust. Okay? And if you did that, okay, you need to select people who will join the research team or the research group. And selecting means they would also undergo trainings, studies, seminars maybe in on how to do researches, and then choice and definition of the theme of the research and training of the local researchers. And then second phase na, pag marunong na sila, and data gathering na. Okay, may mga tools na gagamitin, alam niyan kasi nag-research kayo. And third, collective data synthesis. So this is you already treating the or studying the data that you have collected, the information that you have. Okay, you analyze it, you study it, hanggang sa meron kang lalabas sa conclusion and even recommendation of from the data that you had. Okay, so ano mo yan, uh, aralin mo. Okay. So this, according to community view, for example, this is the problems. If you remember, I presented to you before during our orientation yung needs analysis. Okay, that's one way of research. Okay, needs analysis. What are the needs? Okay, after doing research, you analyze these are the needs of the community. Yun yung isa sa halimbawa sa Roman numeral number 3, collective data synthesis and analysis. Then number 4, kung ano yung naging result ng research mo, ng needs analysis mo, kung ano mang research ang ginawa mo, you are going to disseminate it and you are going to utilize it. When you say disseminate is, you're going to inform the institution where you are acquainted or you belong, then sa community din po, community people and community leaders. Ito po yung lumabas sa mag-aaral, ito po yung needs ng community ninyo. Okay? And we say utilize is, you're going to do something with the output of the research. Hindi pwedeng hanggang doon na lang, nalaman mo yung problema. Dapat, anong gagawin mo ngayon doon sa, sa, sa nagawa mong analysis, sa nakuha mong mga information. Okay, remember, this should be action research. The results should be solved. And this should be put into action. Okay? This, yung pagkakuha mo ng analysis ng or conclusion based from the data, hindi doon nagtatapos. Okay? How will you give justice to the research na magagamit mo siya? Okay? Anong gagawin mo dun sa mga data na nakuha mo? Okay? Nakuha mo o na-analyze mo. Anong gagawin mo sa analysis mo? Hindi pwedeng hanggang analysis na lang. Okay? You should act upon it. Okay. So, this ends our video lecture for the second part. We are going to continue this Sa ano na tayo, next topic, which is COPAR. And so, combination na ng community organizing and participatory action research. Kanina is CO, community organization or community organizing. Then the second one, followed by participatory action research. Then next, pangatlo, is combination ng dalawa. Community organizing plus participatory action research or COPAR. And so thank you and see you in the next video lecture.